It's a great day at Franklin Orthopedics. Hey, you guys, I'm Dr. Greg Cook. We're going to take a few minutes and talk about carpal tunnel syndrome. Not many patients come in to me and say, I have carpal tunnel syndrome, but they'll come in and they say, my wrist hurts, or even more commonly, I have numbness or tingling in my fingers. Now, there's a lot of causes for numbness and tingling, and that's why perhaps you should come in and let us see you. However, a few words of quick advice. If you have numbness and tingling in your hand, specifically the thumb, index, and long fingers, you may well have carpal tunnel syndrome. Early quick treatment for you to do would be to consider anti-inflammatory medicines. Perhaps Advil or Aleve over the counter would be a great place to start. A lot of times patients with carpal tunnel get relief if they will hold their wrist in a more neutral position. It's really common at night to sleep with our wrist rather bent, and if you can get a brace, you can buy these over the counter that hold your wrist in a straight position. That will go a long way toward relieving stress on the nerve that causes carpal tunnel syndrome. Carpal tunnel is also related to people that do a lot of repetitive use of their hands. Sometimes if this is your occupation, you may not be able to easily change that. But if you're doing a hobby where you're repetitively using your wrist or your hand, it may be that you could take a few days off from that and get relief just by your activity modification. If you continue to have trouble, of course it's time to come in and let us take a look. Evaluation would consist of an exam, of course. There's a lot of other things that can cause numbness and tingling in the hand, and we want to make sure that you don't have one of those. If we confirm that you have carpal tunnel, we treat it with our version of a wrist splint. We have physical therapy available, cortisone, medication of the shot version or the pill version can be helpful. If we're especially concerned about the severity of your carpal tunnel, we would probably send you for a nerve conduction study. It's a neurology evaluation to see how bad your carpal tunnel may be. If you're found to have moderate to severe carpal tunnel, that will bring into our discussion the pros and cons of surgical treatment as well. So if you have carpal tunnel, don't live with that for very long because you can get permanent nerve damage. Come on into Franklin Orthopedics and let's take a look.